32 is approximately 0.5312.
Waiting for at least 3 people to come in to the chat room and identify themselves so that you guys can play for them. That's how we're going to work this.
What are we playing?
You know, the grossest medical story. You brought one, right?
I brought one in.
Yeah. So we didn't really have a winner last time. I mean, we had a winner, but we didn't play. So instead of having consequences, I was thinking the way we'll do this is when we do this game, which we'll do like once every 3 weeks or something.
Okay.
You guys will play for somebody. Like you'll play for Sean Pedrick,
But
Tacey will play for somebody, and then whoever wins the next month or the next week, we'll send them, you know, something, autographed piece of shit or something stupid like that.
Cool.
Okay.
Sounds lovely.
Mine's gross, but it's not that gross. It's hard when you look up disgusting penis or whatever.
Yeah, right. Discussing penis.
The
And then you see
stories
your
are really-
husband.
Yeah.
They're not. That's how I like. I was kind of like, you know, it's hard. You can just only describe like an infection.
I can see what you're saying, Sean. Oh, sorry, I'm talking.
Some kind of condition that I think is just grotesque.
I'm doing an incident. An incident. So I'm supposed to take 4 of those today?
Yeah, I would start 2 twice a day. And you can go up to 3 times if you need to.
That's a lot.
So it's good for construction.
What is it?
Jolly Shelly outside.
Okay. I'm glad I know that.
Jolly Shelly outside.
Drug interactions?
No, there's nothing that should affect anything. Oh, and that's the other thing. I meant to stop and get you, and I didn't have a chance to get you.
Okay.
Clearing sage oil. Clearing
Where the hell do you get that?
pharmacy. Max, you just literally can rub it on. Literally helps stop problems. Just don't.
Will you take that?
Yeah, of course.
I'll have it.
Yeah. There's Carla. Hey, Carla.
Okay. So will you write this down somewhere in your notes, Scott?
No pen
you're
back
taking
here.
your notes, right?
We don't have a pen.
I got
It's
it.
okay. Scott takes notes. So, Sean, you're playing for Sean Pedrick.
Okay.
You ready for the next one?
I'm ready.
Tacey's playing for Carla Finch. And Lydia is playing for Richie Archer.
Hey, Richie. Sorry about your luck, buddy. You're getting ready to lose.
Okay. All right. So when we get to that part, you'll have to read out that, and then you guys will do your stories, and then people will vote, and next week we'll let everybody know. Okay. You guys ready to go? I think I'm ready.
Ready.
I think we're ready.
Oh, it'd be probably good if I recorded this.
Yes. That would be the one thing we really don't want to not do.
You cold?
No, I'm just trying to.
And then you can't see anything. Nothing.
I know.
I promise you.
This was just my outfit plan. Was this jacket?
Where are you going?
Just to walk at Sugar Hollow and at the park and drinks.
Sounds fun.
Yeah. My little girl's staying with her dad tonight.
Oh, so what are you gonna do?
I'm gonna go have some drinks.
With some groovy dudes?
No, just one.
One
bitter-
groovy dude?
One bitter woman.
Oh, just one bitter, two bitter women.
Well, she's married and happy. She's got big boobs, so
Really?
maybe just one bitter woman.
Well, big boobs will make you happy, right, Tace?
Apparently so. That's what I'm told.
No. No.
We need to do an episode on
That's a
all
lot
the
of
different
money.
types of breast implants.
Okay,
Yes.
yeah, that'd be good. Why don't we
Like,
do that next time you're here?
Yeah.
What can go wrong?
What
and
can go wrong and what can go right.
Yeah, everything can go right.
And then at the end of it, maybe I'll choose which type.
Oh, are you thinking
Oh.
of getting them? Oh, wait, no, listen, if you are, then yes, this would be awesome.
Yeah. I'm thinking about it.
Okay,
Yeah.
yeah, all right.
Okay.
I think I have some I can share.
Yeah. No, we'll get lots of input and stuff. It'll be great.
I
That'll be
formerly
fun.
Had muscle behind here. Formerly had muscle.
Can we talk about that today? That
Yeah.
just that we're thinking about
That's fine.
about something?
Sure.
Oh, yeah, it'd be fun. All right.
So glad I had it set on 77.
It's okay. It's okay. You didn't do anything. You didn't do anything wrong. It's not anything like that. It's just this thing sucks, and then half the time it kicks the breaker off, and then we have nothing, and then all the computers reset because that piece of shit eternal battery doesn't work. I've got to get in here and do some work. The next time Tacey goes away for the weekend, that's what I'm doing the whole weekend, is redoing this place. What?
No, I know how it is. It's like we've been trying to do that for 15 years.
I know.
Yeah.
I know.
I've
No,
been
you're.
hearing that for a long time.
I mean, it's
Oh,
just, I know how
whatever.
it is.
Fuck all of you guys.
We're trying to
Why
My
would
be
you
ass
go away?
hurts.
Don't
I've
you
got a
wanna
headache.
go?
I've had
We
a
get it,
horrible
Steve.
day. Y'all shitting on me.
We're trying to
We
be
get
sympathetic.
it.
No, I know. I'm just
jackass.
fucking.
I'll come
with
help you redo it.
you. I'm the jackass.
No, you don't want to help him redo this.
Do like
No.
No, I got to do this by myself.
fireproof
It's
That'd be a
paint.
terrible
it's-
plan.
there's too many cables. It's just nobody can help me with this. It's too cramped in here.
Yeah.
Plus, it's
just-
110 degrees.
Yeah, and I don't mind it. You know, that's the thing. Or I can just take my clothes off.
Ooh.
Or you could just take his clothes off.
Yeah. Well, I mean, if it gets too hot. Okay. What
And you'll
was
have
I
an extra
taping on
cable
here?
you might trip.
All right, you ready? Here we go.
Yeah, let's do this.
It's time for Weird Medicine with Dr.
I don't even know
Steve.
if I've got everything.
I've got diphtheria crushing my esophagus. I've got Ebola virus dripping from my nose. I've got the leprosy of the heart valve exacerbating my incredible woes. I want to take my brain out and blast it with the wave, an ultrasonic, echographic, and a pulsating shave. I want a magic pill for all my ailments, the health equivalent to Citizen Kane. And if I don't get it now in a tablet, I think I'm doomed and I'll have to go insane. I want a requiem.
It's Weird Medicine, the first and still only uncensored medical show in the history of broadcast radio, and the longest running show on this channel. I'm Dr. Steve with my little pal, Dr. Scott, the traditional Chinese medicine provider, gives me street cred with the wacko alternative medicine assholes. Hello, Dr. Scott.
Hey, Dr. Steve.
And my partner in all things. Hello, Tacey.
Hello.
And P.A. Lydia, back from sabbatical. Hello, P.A. Lydia.
Hey,
Yay.
hey, y'all.
Awesome. We got lots to talk about. It's been a long time. This is a show for people who had never listened to a medical show on the radio. If you got a question you're embarrassed to take to your regular provider, or if you can't find an answer anywhere else, give us a call at 347-766-4323. That's 347-POOHEAD. Visit our website at drsteve.com for podcasts, medical news, and stuff you can buy I can't mention contractually. Most importantly, we are not your medical providers. Please take everything you hear with a grain of salt. Don't act on anything you hear on this show without talking it over with your doctor, nurse practitioner, physician assistant, pharmacist, chiropractor, acupuncturist, master physical therapist, or whatever. All right, very good. Well, welcome back, P.A. Lydia.
Thank you, guys. It's been a minute.
And we have a game to play. And should we? Well, let's we'll get to it. We have a fun game that we played last time. It was Grossest Medical Story. We're going to continue that, but we have a little bit of a twist going forward.
I like
Ooh,
twists.
I know. Let me see. Where is that?
But I don't want homework every week. I just want that to be known.
I know you don't. And
Too busy.
So yeah, that retirement really.
I mean, what do
Working
you
for you,
expect
huh?
for me to do?
So we will do it like every third show or something like that, or whatever. We'll just do it whenever the hell we want to do
Okay.
it. How about that?
Okay.
It's like I wish I had the Napoleon Dynamite drop. What you gonna do today, Napoleon? Whatever I want. Gosh,
There it is.
Uncle Rico. I think I could throw that football over that there mountain. All right. So yes, P.A. Lydia. We before the show we were talking about you were considering having some cosmetic surgery done. Is that okay to talk
That's the way
about
to
it?
put it. Yeah.
Yeah, yeah,
Boob
yeah.
job.
Yeah, she wants to get a boob job. So
Potentially.
I think that's always one of those. And but you brought it up that maybe we should do a show about different breast implants and discuss the pros, cons, and all that kind of stuff. Maybe what we could do is make this a long, because you're just thinking about it, right?
Yeah.
Maybe we could make this sort of a long bit and have people on the show that have had breast implants, different kinds of breast augmentation. We could even get some of the, you want to get them in the
We could
studio and
feel
actually
them?
feel them. Okay.
It might require a consent form.
Of course.
But that's what you have to do. You know, there's just so many different kinds. There are the different implants of silicone or saline, and then there's the fat transfer, and then there's the subpectoral.
Yeah.
and
What
there's just
fat
too
would you
much.
transfer, though? You're
Probably
very
like
thin.
the inner thigh.
Okay. Well, because there are different body types. There are ectomorphs or tall and thin. That's kind of what you are. And then mesomorphs are in between. Then the endomorphs are sort of the pear-shaped,
Yeah.
those people.
You could always gain weight.
Obeso-Americans.
I could gain weight for that role.
Yeah, you could. And so, yeah, we could get people in here, but I was thinking also, Lainey Spicer is a contact. She's a friend of Scott's and mine, and she's been trying to get some of her clients on here because she's a publicist. And many of those have had breast augmentation, some of them to the extreme, and they may be willing to give some advice. And then we could kill two birds with one stone because Lainey really has been bugging me to get some of her clients on here recently.
That sounds wonderful.
So that may be kind of fun.
Yeah.
And then you do whatever you want to do.
Yeah.
Do it or don't, but it'll, yeah,
At least I could just end the discussion in my head.
that's right.
Yeah.
Right. And Tacey went the other way.
Went the other way.
She had, you wouldn't know it, but
Stop it.
is that bad?
It is bad.
Well,
to
you
say
complain
that.
about it.
Yeah. Well,
You've complained about it on this show that you had breast, reduction mammoplasty, and you're still the big booby girl.
that's how it goes, though.
Yeah.
I mean, most people who have had a breast reduction, and when I had mine, this really irritated me. People would say, well, why did you get the augmentation in the first place?
Right.
And I'm like, why would I
I
have
thought you did
done
that on
that to
purpose.
myself to start with?
Because
Like,
people do that.
but it was obscene, and my back was killing. I mean, it was
Yeah. If
triple Fs. I mean, come on.
If by obscene you mean awesome, I
no, it was
agree.
terrible. It was absolutely terrible.
So did you have implants?
No,
Okay.
No, I did
You were
not.
naturally a triple F.
but people just thought I had done that to myself.
I see.
Right.
Okay.
That
On the-
I had gotten triple
On
F.
a porn
I
site,
gotcha.
she would have been listed under busty naturals.
Yeah.
Oh.
Yes.
And people aren't afraid to ask you, well, why did you do that anyway? And it's
Yeah.
like, I didn't do that. So that irritates
Yeah,
me.
people aren't afraid to say anything as long as it's, disparaging
Right.
someone's body type.
Boy, they really don't.
There's so many things that they're terrified to say, but that one is fine. Why don't you just quit eating?
Yeah.
Yeah.
Try exercising.
Yeah.
Yeah. Thanks.
Yeah, they're totally fine. And has anybody ever said that to you? maybe
What?
you should try exercising. This woman works out more than anybody I've ever seen. She is the strongest woman I've ever had the opportunity to mess with. Maybe Ronda Rousey could beat her ass,
She
but
got
that's
nothing on taste.
that's what it would take to beat Tacey's
No,
ass. We
that's not
wrestled
true.
back when, a while back when we used to, play around more than we do now. I mean, just play around. I'm not talking about. I'm not. It's not a euphemism
Wrestling.
for intercourse. I'm just talking about playing around.
Mm-hmm.
And we started wrestling, and she kicked my ass, and I was a wrestler in high school. And absolutely kicked my ass, and to the point I think I tapped out, and then she wouldn't stop, and I was like, "You've got to stop!" Just turned me into a little bitch. I was her bitch. It was unbelievable. She's unbelievably strong, and she'll take 250. Of course, she always overpacks, so her luggage is always right at the edge of being legal, or and she'll just pick them up and just whoop and just right up the stairs. Doesn't even think about it. Amazing.
She's tough.
Yep.
She's a house.
Yeah.
She's a
I wouldn't
house.
say that.
That's also disparaging.
Well, that's because you're an idiot.
That's good to know. I'm a hoss.
That was Scott. That was not me.
Yes, you can kick me later.
Anyway, but yeah, Tacey's very physically strong.
And mentally strong.
Not so much.
Very
When you
mentally
quit working, it's amazing how dumb you get. How quick.
That's
I
what
mean,
I'm
it's-
afraid of.
Or you realize maybe something. I don't know. I'm just.
Maybe you were dumb the whole time. Maybe the job you had didn't require a lot.
You just didn't know it.
I just didn't know it.
No, hell
That's
no.
quite possible.
You were pre-med. You're not dumb. Nobody can be dumb and do all that. But anyway, all right. So so we'll do that. So I'll work on getting some people in here,
Okay.
and then when can you come back? The other three have just finked out on us, so you're welcome to come back every week if you
Okay.
want to for a
Yeah.
while or forever.
Can't imagine why they wouldn't want to spend time in this sauna
I
we
mean,
have here.
I like it.
With such
Yeah.
great company.
I mean, I know.
You just let me know when you can
Okay,
come, and
yeah,
I'll
I know
have
I
some
can't
people
next
lined
week, but otherwise I'm only on a Monday, Friday work schedule, so
Okay.
that should be okay.
up. All right, we'll do it.
Yeah, so maybe 2 weeks from now.
Okay. Yeah, I think we actually know somebody that had breast augmentation that you could talk to that's been on the show before. So we could talk to her first, and then because that's a less extreme example if she'll do it. And I'm not saying any names or.
Oh gosh, I mean, how many people do we not know that have had it?
Oh, that's true. That's true. And then our other friend. Yeah, so we can work this out. We can get people in the studio, and then I really want to get some of Laney's people on here because some of those have gone from, A cups to, double, triple G cups and stuff.
Holy moly.
And then some of them have had problems with them. I talked to somebody that had theirs removed because they kept moving up to their neck.
That's what I'm afraid
Because
of.
they did them up well. So what that person would tell you is, don't let them put it above the muscle. It's got to go below. Because hers were above the muscle, they could just move around. They were just moving around all the time.
Yep.
So anyway,
Well,
all
then
right.
I know somebody who went to a physician and she's been having a lot of health issues, and the physician was like, "Have you ever thought maybe your breast implants are leaking?"
Right. So that's a really interesting
She
case.
doesn't feel like they are, but it's something you hear about every now and then.
Or some systemic inflammatory response to a foreign body. I'm also worried about that. Yeah.
Well, okay. So there is an immune adjuvant response to silicone and the silicone. And yeah, it'd be funny if they put silicon in there, and then you could just like have a CPU and you could
Right.
compute things with your
Lots of
boobs.
Do my
It'd be
charting.
neat. Yeah, you can do your
Lots of
charting.
computation.
Please talk into my baby.
Let me see. I think it's is it Asia syndrome? Damn it! It's autoimmune. Shit. Let me stop the show just for a second. I want to get this
Too
right.
hot to stop the show.
I know, honey. I'm sorry. Immune.
That's what she said.
Adjuvant. If anybody in the chat
I'm
room knows
definitely
the
too
answer.
hot to stop the show.
Silicone.
Did you take your drugs yet?
Mm-hmm.
Good girl.
You know, in my office, I could have brought this up just immediately. Oh, yeah, it is Asia syndrome. Okay. All right. Hang on. Let me run this back. Keyboard's out of batteries. Recording on the wrong channel. Just noticed that, but that's okay. I can fix that real quick. Okay, there we go. So, yeah, it is. It's shit fire. Okay. Yeah, it is. It's autoimmune and autoinflammatory syndrome induced by adjuvants. And it's a spectrum of immune-mediated disease triggered by chronic exposure to adjuvants, which are substances meant to enhance antigen-specific immune response. And silicone implants can be associated with that, and it can cause rheumatoid-type syndromes. And one of those that we've seen pretty frequently is this sort of non-specific autoimmune disorder. And but it is unusual. It's so unusually and rarely seen that some providers still don't believe it exists.
Oh, okay.
Or that it's a problem.
I wonder if there are any like analyses of like baseline
Yes.
room factors or ANA levels or anything.
Well, I think there are, and we can go over all that stuff before you do anything. But I do know that for a while they stopped doing the silicone and we're going with saline, and now they're going back to it because the silicone implants really are better. They're more natural. And not to say that the saline ones can't be great, but they can. But I think it takes less skill to get a silicone implant to do what you want it to, and the risk is really quite low. And the thing is that with those, if you get that with the silicone, it's supposed to get better as long as you just remove the implant. So you don't want to go through that if you can avoid it. That's extremely rare. I've seen one in my career that I diagnosed, and that's 37, whatever. However, I don't even know how many years it is. I've lost track.
A lot.
And am I going to be 67 this year or am I 68 this year?
So I'm 49, so you were going to be 67.
This whole year I thought I was 67 already. I did it again. This is the second time that I've gotten a free year.
You fast
Because I'm stupid. No, yeah, I've been telling everybody I was 67.
Yeah.
And then I thought, well, fuck, when this next birthday, which is coming up, I'm going to be 68, but actually I'm going to be 67, so I got a free year out of it.
I love it. That's awesome.
Well, that's because you're an idiot.
Yes, that's true. Okay. All righty. So I think that'll be fun.
Yeah, that's a great series.
Okay.
Cool.
Yeah,
do it.
a great series. Let's do the game.
Okay.
Last week we had the grossest medical story. Lady Diagnosis brought your magic mushroom blood culture thing, which is a good one to do a second time. Tacey brought the bed bug jar fountain. And Dr. Scott brought the 82-foot tapeworm. Yeah. And so everybody voted.
I won, I bet.
And with 53% of the vote, Dr. Scott won.
Nice.
Good for you, Dr. Scott. That is pretty gross.
Thank you.
Tacey had about 35% of the vote, and Lady Diagnosis got the rest. So well done. Well done, sir. That one was disgusting.
Thank you.
And let's see if there were any comments on this one. This person said, although in real life I'd rather have 10 cases of bed bugs rather than one giant tapeworm or a fungal blood nightmare, I have to cast my vote to Tacy for being so descriptive. Out of the three, hers grossed me out the most. It was gross the way
It
you
really was
described it.
gross. I mean, in the story that I read, the guy was picking them off of him, putting them in a mason jar, and then they were crawling out as fast as he could pick them off. And
There
the
were
mason
so many
jar
in
was
there.
3/4 full. of bed bugs. So disgusting.
Yeah.
So gross.
Let's see here. So we're going to do another one today.
Okay.
All right. And what we're going to do is I came up with this. See, we ripped this off from the Creep Off, which does, creepiest human beings. And if you like true crime and you like comedy, check out the Creep Off podcast. It's a good one. And then if they lose 5 times, they spin the wheel of consequences and they have to do horrible things. So, like, one of the hosts had to do the polar plunge in the middle of winter in Rochester, New York.
Oh my goodness.
And which there's no actual video documentation that he did it. There's documentation of him going toward the lake and coming out, but I believe him because he had a horrible look on his face. But people, so it was fun. That kind of extended the bit because people were shitting on him. And then the other guy had to wear a cow bikini on the show, on camera, things like that. I don't want to do that.
No.
First off, I'm not playing this fucking game, and second off, I couldn't get Tacy or Scott.
I'd wear a cow bikini today. It's so hot.
I would too. I
But
would
see,
too.
then that's a good thing. It's no good if you want to do it.
I'd fight it.
So,
I'd start over
so
it.
what we're going to do instead, because we're more of a positive, positive type show, is we're going to instead give awards away to whoever wins. So you're going to be playing for people, and hang on just a second. Hang on, I gotta go back. I'm sorry.
You gonna play music today?
What? No?
Stick my head in the snow.
Are you guys hot?
Oh, fuck, it's hot.
Okay. Sorry.
Couldn't
All right.
find anything. Did you see it?
No, I'll let you surprise me.
Yeah. See, I was in the dealing with something else. Okay, there we go. Type of show we're going to, you guys are going to be playing for people.
Okay.
Okay?
Sounds good.
So Dr. Scott will be playing for someone, Tacy will be playing for someone, and PA Lydia will be playing for someone. And next week, when the announcement is made of the winner, then that person, whoever was attached to the one that brought the story that wins, will send them something. And it could be, it's a gift, it's not a prize. So one week it might be an autographed picture, which why would anybody want that of us? Or we have some vacuum bottles that are weird medicine bottles, and maybe we'll sign it or something. We'll do something like that. So for the first one, we'll probably do something like that. So Scott, you want to say who everyone is playing for today?
Yes, I would love to. So the winner will be Sean today because he's playing with me, Sean Pedrick.
Sean Pedrick is playing with you. Oh, and by the way, these were chosen from our chat room, which is, we don't do a video show on purpose. We're doing it just to have an audience. No matter how small it is, we don't care if it's 5 people. We're fine with that because we get our views from. Our income comes from our audio shows that we, on Patreon and on just our podcast. So we don't do the video to be a video show. So we don't care if nobody signs up or subscribes, although if you subscribe, you can be notified that we're going live. So anyway, we got this out of the chat room. We usually record on Wednesday or Thursday, and you just got to watch our Twitter feed or subscribe and click the notification button. Okay, so Scott is playing for Sean Pedrick.
Yes.
Tacey.
Carla Finch.
Carla
The
Finch,
Carla
excellent.
Finch.
And then P.A. Lydia.
Richie Archer.
Richie Archer. Okay, very good.
Okay, Richie.
In other words, playing for second, third place.
Yeah.
Okay, all right. So you're that. Well, let me see. Scott won, so he has to go last. No, I'm sorry. He has to go first. If you win, you go first.
Hey,
Because
how come Tacey?
like a draft.
Tacey somehow Tacey's managed to swing the.
that's right.
I don't blame him.
So Dr. Scott,
let's hear it.
you're going first.
All right. So wasn't the topic below the belt?
Yeah.
All
yes.
right.
Yes. Thank you.
So we're going below the belt today.
The topic is grossest medical story below the belt, which, by the way, is probably going to be the topic every single time. But anyway.
It's not an easy topic, though, because you look stuff up, and if you look up penises, it's, and my penis got cut, or it got broken, or,
Yeah.
it's just, it's,
Yeah.
Not very fun.
no, it wasn't as fun as the last
There are other
one.
things other than penises below the belt. But
Yes,
I
Exactly.
hear
Well,
what you're saying.
Toes.
you look up
Toes. That's
right,
right.
that's right.
Knees.
vaginas the same way. I mean, it's just
Popliteal fossas.
Popliteal's fosses.
All kinds
Is
of
it
stuff.
is it below the belt and above the?
well, that's
thigh.
what I thought.
It was. I think it was pretty
Yeah.
open.
I think
for
I said anything
interpretation.
in front that regarding the jungle region.
Yeah. Of course, if you have a really high belt, I guess you could do like naval stuff. But.
Yeah. Okay.
Ooh, I bet
You
it's
do whatever
worse.
you
All
want.
right, here we go. Here's mine.
All right.
All right.
So, I'm going with the largest scrotum ever recorded. A guy diagnosed with he had a 132-pound scrotum, diagnosed with elephantiasis of his scrotum.
Oh my God.
What'd they do with it?
Well, it's
Well, let him tell-
it's a yeah, well,
132.
132 pounds. Yep, and it's a form of scrotal lymphedema, and they actually had to go in and surgically remove it. So, yeah, that looks pretty uncomfortable.
Okay.
Yes.
Did they give any size comparisons?
So you're going to tell the story, or I mean, that's just your overview, right? You're going to read the story.
That is the story. This guy started developing this scrotal lymphedema, and it got worse and worse and grew really quickly. And they wound up. They've actually got some images of him. Poor thing. It's incredible.
Okay.
If you can imagine
Is it
130.
shiny?
You got to sell it
Like
to
a
the
shiny
people who are voting
testicle?
for you.
I don't have to sell this. It's a 132-pound scrotum, for God's sakes.
Okay, fair.
Poor guy.
Fair.
God bless
Was
him.
this the guy that was on Howard Stern?
I don't know. I don't know. But he
There was a guy that had. So what this is massive scrotal edema is what it's called, and the testicles are actually. They may be non-existent in there. It's not
Right.
enlargement of the testicles, and it's not fluid in the scrotum. It's actually interstitial fluid. In other words, fluid in the tissues of the scrotum and surrounding the testicles and stuff. And it's more solid than anything else. How much did his nuts weigh?
Yeah, 132 pounds.
Oh, wow.
Almost, yeah. And of course they had to go in and surgically remove it. But I mean,
You would think that if you had 130 pounds something hanging around between your legs, it would just rip.
Rip off.
Oh, the skin,
yeah.
yeah.
It would just rip off, and you would be walking down the street, and it would just you'd
I
leave
bet
it
he
behind.
couldn't walk.
Maybe
Yeah.
like
No,
a sling.
Well, you
like
gotta
a
have like
ball
a
hammock.
it's a sling like a cup we used to wear in baseball, but quite a bit larger. And I've actually heard of guys with similar conditions having to carry their testicles around in wheelbarrows.
Yeah.
Especially in third world countries, if they get because you could
In
technically
first world countries, there's no other way to do it.
Yeah,
If
obviously.
you can't afford insurance, that one guy on Howard Stern, he didn't have insurance, and I would have thought some urologists just do it for free, just for the to
Pub.
do it.
Yeah, or for the kindness.
Yeah.
Yeah, that and the other thing, Dr. Steve, to consider is just fear of doctors. A lot of people have these problems, and we see them. All of us in here see them every single day. People they fear going to the doctor. They fear having a diagnosis. They fear a procedure. And I'm not saying that's what was wrong with this guy, but that happens all the time. If somebody come in with a growth, like how long has it been there? A couple of years. Like,
if I was participating in this, I would, and we did grossest genital trauma, accidental. I've told this story on here before, where this guy he worked in a place where they had a bunch of belts, like leather or rubber belts that went all over the place. It could have been a textile place or something.
Some kind of manufacturing.
Some manufacturing thing when they had these belts. And what he would do is he would rub his dick on the belt as it was going by, and the vibration, he would, eventually complete the transaction. And he apparently he had a very
throwback.
He had a
goodness.
very isolated place where he could do this, right? Well, one day his scrotum gets caught between the lower part of the belt and the wheel, and it just went like that, and it just took his nuts and just threw him out the window. They flew out the window. And he was so embarrassed he didn't want to go. Well, shit, hey, I was masturbating on this belt and go to employee health, so he took a staple gun and stapled his scrotum back together. And then about a week later, he showed up at the emergency room in sepsis. What we call sepsis is, blood infection
Poison,
by bacteria, and this giant abscess in his groin
bless him.
where his scrotum used to be. And that's when he told the story of what actually happened. So, but if you do something like that, if you go to the emergency room and we've said this before too, and you've got a Coke bottle shoved up your ass, just say you sat on it. Everybody will be fine with
Nobody will
that.
ask a question.
They won't ask another question because that's the fiction that we've all agreed on, that we can say, oh God, I sat on this Coke bottle and I don't know what happened, but now I can't get it out. Oh, did you?
Let us help you with that.
Yeah, let us fix it. And they will fix it. So if your testicle gets thrown out a window by a belt, and you don't want to say that you were masturbating at work and your scrotum got ripped open and your testicle flew out a window, you can just say
You sat on it. Sat on the belt.
that you sat on it. There you go. Here we go.
Give yourself a bill.
Or you could, what fiction could you come up with on that one?
That'd be hard to.
That'd be a tough one. Well, I just fell against a knife or something. You just make up something on the way to the emergency room, but don't try to fix it yourself and then and then think it's going to go away. Well, if you do that one, the cops are showing up.
They are going to show up.
That's the problem. So you can't. Then the whole story is going to fall apart, and then you have to tell the truth.
Oh, bless him.
And
Lord have mercy.
Out the window.
Yep, it flew
Wonder if
out
they
the
picked
window.
him up.
I don't think so. He stapled his shit together and said, I got to go home.
I gotta go. I'm having some pain
All right.
below the belt.
So that's Dr. Scott, scrotal lymphedema. Tacey, what you got?
Okay, I'm going to try to class this up, but it's really difficult.
Okay.
So the title is called The Pussy Pimple,
Okay.
and it's stolen from BuzzFeed.
Okay, no, that's fine. You steal anywhere you want to.
And, okay, here's the story. She got a horrible pimple on the hood of her clitoris.
Excellent.
She tried to pop it one night, but it was just too painful. The pimple kept getting bigger and bigger and bigger until it was the size of a marble. It was so swollen and the skin was so sensitive.
Would this be an Aggie or, well, shit, I forgot all the marble names. There's the big giant ones and the little one. God damn it. Oh,
I mean,
well.
okay,
Boo.
nerd.
Boo.
Okay. It was so swollen and the skin was so sensitive that when she walked or sat down, it rubbed against her underwear and pants, causing pain.
Okay.
It eventually popped on its own, and the amount of pus that came out was insane.
Oh, I don't
So
think we used to use.
I mean, like I said, it's hard to find a disgusting story, but if you
How did that
imagine
end up on
your
BuzzFeed?
clitoris having
Marble size.
a marble-sized pimple,
I've never seen a clitoral abscess before.
Yeah.
Let me look that one up.
I wouldn't have. Would you even? You have to cut it.
This is vulvar abscess, but periclitoral abscess. Here we go. Image of a, no thank you. Okay, image of a periclitoral abscess presenting with minimal swelling and distortion. Periclitoral abscesses are rare, with less than 20 reported in the medical literature.
Hey.
21 if you count BuzzFeed as a medical journal. Images without severely distorted clitori are lacking in the literature. Oh, well. I'm sorry that you guys are missing out on that, which led to multiple misdiagnoses in this case. Okay, this is a report of a 20-year-old patient who presented with clitoral swelling and pain without fever. In the clinical setting, even when mild clitoral swelling is seen, the possible presence of an abscess should be considered, with incision and drainage if present. You know why they missed this in this case?
What?
Do you know why? Because nobody bothered to fucking do a pelvic exam.
Yeah, have a look, yeah.
They just looked, ooh, here, let me separate the, whatever these things are called, and look in there. I mean, that's how dumb they had to be. And I'm hearing now, hey, Tacey or Lydia, either one of you, when you guys go to get your pap smear, do they do a bimanual exam anymore? I was
get
told
one.
that they stopped doing that.
I get one.
You do?
Mm-hmm.
Yeah, it's been a couple years, but yeah.
Okay, good. Because somebody told me they're not doing bimanual exams anymore. And a bimanual, by the way, is when you have two fingers in the vagina and then you push up and then you can feel ovarian tube, ovarian tubes, fallopian tubes. You can feel ovaries. You can feel the uterus, and you can press it up against your other hand. So that you can, feel it better.
Masses and tumors and
yes,
stuff. Yeah.
and then the next thing you do, tell me this, are they doing rectovaginal exams?
No.
I have not had that.
That's bullshit, okay?
Yeah.
So, we would do, and this is the whole two in the pink, one in the stink thing is what, the colloquialism, but it is a true exam where you do another bimanual exam with your third finger in the rectum, two fingers in the vagina, and then you feel around for that. In doing one of those, I found a pericolic tumor. A perirectal tumor, sorry. And it was an ovary that had dropped down and had gotten so large, and the only way you could feel it was when you did the rectal exam.
Wow.
So I don't understand.
Is that the Krunkenberg sign? Krunkenberg's tumor?
Ooh, I don't know.
I think it is. It's an ovarian sign where you can have the rectal cul-de-sac mass.
Oh yeah,
Krunkenberg, I think.
How do you spell that?
Krukenberg.
B-U-R-G. Krunkenberg tumor. Malignancy in the ovary that metastasized from primary site, classically the GI tract. Now I don't know about
No,
that.
that's not it. Somehow there's a sign where you feel palpated at the rectal wall.
Well, let's look that one up then.
Yeah.
All I know is you can do it, and if you don't do it, you can't do it.
It's at Bloomer's Shelf. Let's see.
This
Okay.
you might be too smart for this show.
A little bit.
Wouldn't take much to
I know. We're
to
a bunch of
surpass this crowd.
dumbasses.
She could trip over this.
Okay, in medicine, Bloomer's Shelf denotes a metastatic tumor deposit on digital rectal or vaginal exam, indicating a tumor cell dissemination from an abdominal, gastric, pancreatic, colonic cancer, or lung malignancy. Yeah.
Give yourself a bill!
Growing in the rectovesical or rectouterine pouch.
Yes, and how in the hell would you find that if you don't examine it?
Exactly.
Okay, so I'm going to give myself a bell
yourself-
for that.
Give yourself a bill!
Give Lydia a bell for knowing the name of it. Good Lord.
That's impressive. Yeah.
I teach PA students, so
Yeah.
I try to tell them everything.
Yeah. No, that's awesome. I won't forget that one till tonight.
Well, I was going to say until like now.
I already forgot. What was that? You're wearing your bloomers? What? So the reason that they missed it on the case that I was reading is because no one felt in there. They just looked, and we've got to stop just looking at things and go back to physical diagnosis. You got a woman in your office that's complaining of clitoral pain, and if you just look at it and go, nope, looks fine to me, that's not going to work. You got to stick your fingers in there and feel around, and if they had curled their fingers up as you are supposed to do, they would have felt that abscess. And they would have treated her, because apparently she went to like 5 different doctors before they figured it out. Yeah. Isn't that crazy? So that's a good one. So we're going to call, okay, Tacey, I'm going to call this one the P exclamation point $, hashtag Y pimple.
Okay.
All right. All right. PA Lydia?
Okay. Well, I'm highlighting a gross condition.
That's fine.
And when I think about really disgusting things, especially in the medical field, I think of smells.
Oh, yeah.
Right? So
D from Nashville can tell you that one. The most gross medical smell, which we'll play here in a minute, because I don't think you've ever heard that. Okay, good.
yeah. No, so there's one condition with women where, there's like this fishy odor with a KOH prep.
Yep.
However,
Do you want to talk about that now that you brought it up? Because people may not know
well, I
what
was
you're
trying
talking
to remember, isn't it bacterial vaginosis?
Yes.
And then when you add in potassium hydroxide,
It gives off a fishy odor.
yeah.
Yep.
So that's one way to diagnose
called a
bacterial
whiff
vaginosis.
test.
Yeah. Which I've only done a couple of times.
Yeah.
I'm a little bit faster on the
That's why the
flagyl
blind
draw.
man going by the fish market says, "Hello, ladies."
My grandfather always told that joke.
Yep.
Oops, sorry. I keep hitting the wrong
So there's another condition, which is a genetic condition. It's autosomal recessive, so you have to have 2 parents as carriers. It's called trimethylaminuria.
Oh, I've heard of this.
And it's the
Never
fish
seen
odor syndrome,
Wow.
where your secretions, including your vaginal secretions, but also your sweat and your breath, smell like rotting fish.
Oh.
What's the chemical that they make?
So it's an inability to break down lecithin due to a defect in the FMO1 gene. And so if
Okay.
you eat foods higher in lecithin, then your body doesn't break it down as well. I'll have to look up let me look up the chemical. Because
Okay, so what foods have lecithin in them?
so it says fish, eggs.
Oh, so yeah, you eat fish and you smell like fish. Okay, got it.
Yeah, but it's specifically seafood. So freshwater fish are exempt
Oh,
from that issue.
really?
Yeah. Let's see what other foods there were. I have a separate window open. For
So you can eat trout, but not grouper.
correct.
Okay, very good.
Yeah. No salmon.
Well, salmon can be freshwater too, though.
Common sources include egg yolk, soybeans, milk, rapeseed, cottonseed, and sunflower oil. So one of the ways to reduce your fishy odor when you have this syndrome is to avoid those foods. Another way is to take Flagyl. It also recommended reducing sweaty exercise. But it must be such a curse. Like anytime you
Why would
sweat or
Flagyl
speak
work?
with someone, you just smell like rotting fish.
Yeah.
Or if you try to have
Intercourse.
intercourse,
So it's
with
your sweat and your breath.
oral things. Yeah, your sweat, your breath, and all of your secretions.
So if a dude had that,
Yeah.
then oh boy, there wouldn't be any choice between spitting and swallowing. There would just be nothing but
There would-
spitting.
Oh, that
It would be
oh,
spitting and
Stephen.
gagging. Well, honey,
Oh my God.
But
okay,
I
you
swear I was
win.
eating pineapple, darling.
right.
Congratulations.
Pineapple fish.
Oh Lord.
Okay, so we'll put that one up under PA Lydia. Fish jizz. Fish jizz. Okay.
Okay, so the reason is the body is unable to turn a strong smelling chemical called trimethylamine, which is produced in the gut when bacteria break down certain foods high in lecithin, into a different chemical that doesn't smell.
Okay.
So there you go.
And that's one of the issues with asparagus, too. There are some people that will metabolize that chemical in asparagus so that it doesn't smell, and some that won't. And then there are some people that can smell it and some that can't, which is why there's always been this controversy. Because when you have problems with incomplete reception and incomplete transmission, you're going to have all kinds of disagreements. Well, that ain't right. That doesn't really happen. I eat it all the time. It never happens to me. Those could be people that can't smell it, but they do produce it, but they don't ever smell it, but other people around them can. You know, it's just all over the place. Same thing with female ejaculation. There are those women that have coital incontinence. In other words, they produce large volumes of urine when they're sexually stimulated, and then they will squirt lots of clear fluid. But guys that are down there sometimes will say, "Listen, it doesn't taste like piss. It doesn't smell like piss." They're right, because it is ultra filtrated. Free water. It doesn't have any of the normal solutes in it that normal urine does. But some women will ejaculate as well, and so you will have, and it overlaps. So there's anywhere between 7 and 50% of women have coital incontinence, and about the same numbers for female ejaculation. So you'll have some women that don't do either one, some that do both, and some that do one or the other, and no one can ever agree on what it is because everybody's experience is different. That's why you have to look at the science, and there has been science done on these things. So anyway, very interesting. So we'll put that up. So let's remind everyone, Dr. Scott, you are playing for?
The winner, that'd be Sean
Pedrick.
That's correct.
And Tacey, you are playing for?
Second place.
Who was
Carla
Finch.
I think third place.
And then third place, and then Lydia is playing for Richard Archer. Is that right?
That's right?
Okay, all right. So we will let you know next show, and then we'll send your crap out. All three of you, make sure we've got your contact information. And if you would like to play along with this, check us out on our YouTube channel. I think it's just Google Weird Medicine YouTube and it'll come up, and then watch for us to be live.
Yeah.
Okay. All right. Excellent. Anybody have any medical stories before we go to medical questions? Because we only have a little bit of time.
We do have one question that just popped up about migraine auras.
Okay. Yeah.
We've got a question about a migraine aura coming.
Probably listening to this show.
Yeah. I was going to say, if she didn't have one, she probably has one now. Her concern is it doesn't. The auras are not coming with a headache.
Yeah.
A typical migraine headache. She's concerned, does she have brain cancer? Does this cause brain damage?
No, it's there is a percentage of people that have migraines, but they have the aura, but it's not followed by the pain.
The headache, right?
So if you remember, the aura is felt to be caused by spasm of the arteries around the brain, and then when they relax too far and they dilate, and it stimulates the stretch receptors in those arteries, and the brain doesn't like arteries stretched to the point where they're breaking, and that causes pain. What were you going to say, Lydia?
Well, I was just, does that aura last for a certain amount of time after the orgasm, or is that like during the orgasm?
Orgasm.
Yeah, just during the orgasm, you have the aura.
We're talking about migraines.
No, migraine.
I thought you said it was an aura during.
We have a winner. You can come back, Lydia. Yes, you're welcome to come back.
I swear I thought you said it was an aura during.
Is there a reason why you're fixated on that?
I don't know.
Man, you are one pathetic loser.
So anyway.
So I don't know if she's having auras after orgasms or not. I guess we could ask. But let's assume it's associated with her headaches.
Yeah, about 4% of people that have migraine have an aura without a headache. And it's usually young adults in their 20s or 30s, or older adults between 40 and 60. It happened to me when I was 50-something. Don't be embarrassed. You're hilarious. It's hilarious. Yeah. She's hiding her face. And you're on radio. Yeah, and now sometimes you can lose your headache if you had migraines your whole life, and then all of a sudden you just start having the aura. And it can be called an ocular migraine, but that is kind of a misnomer. It's not even in the classification of headache disorders. So if this is something new, you do want to get it checked out. That's the only thing I will tell you. Two sort of things that distinguish migraine aura is that it should affect both eyes, not just one, and that there's a build up of the aura. And, but sometimes it's hard to tell if the visual disturbance is in one or both eyes. So if you want to know, this is what you do. Open a book or something you can look at and start reading, and then cover one eye and look at your book. If you can still see the aura, then you know it's in that eye. Then cover the other eye. If you can still see the aura, you know it's in both eyes.
Okay.
And every person who has an aura should confirm that it's in both eyes, because that puts it in the occipital lobe of the brain rather than in one of the eyes.
Right.
Okay, and that's where you want it to be
Right.
for this. And what I always tell people is when you have something like this happen, the first time, absolutely get it checked out. See a neurologist. They'll do the workup and everything. And then after that, if they tell you it's just, quote unquote, just migraine, then you can ignore it or treat it how you normally treat a migraine. If you have the pain and all that stuff, they'll give you medication and different things that you can do. Okay?
I've got one more if you want one more question for the waiting room.
Yeah,
Do we have time?
yeah, I think so.
Yeah, Richie was asking, Mr. Second Place is asking, he has a question about starting testosterone replacement. Says his sex drive went back up to when he was first married 15 years ago.
Yep.
And his question was, congratulations.
Yep.
And his question is, at what age can his wife start hormone replacement therapies? And does it have the same effect? So that's a good question. So
it is a good question.
Yeah.
So they've continued to change this in women, and the question is, what do they want to do? What are they trying to accomplish? So if she's having pain or dryness or thinning of the vaginal lining, they may do hormone replacement therapy on her just locally, topically. We used to put all women who went through menopause on estrogen, and we found out that we were increasing breast cancer by a small amount. It went, it was 1 in 10,000, but still over hundreds of thousands of women. That's a lot of breast cancer excess cases. So it went from 1 in 11 women had breast cancer to 1 in 11.001, something like that. Lydia, you deal with women with breast cancer all the time. What are you guys talking about? Talking to women about hormone therapy,
Well,
particularly estrogen therapy.
yeah, I mean, certainly if they have the history of breast cancer in general, they
Yep.
should avoid it, especially if they have the history of estrogen positive breast cancer at any point in their history.
Yeah,
they would just completely
No more
avoid it.
estrogen for them.
I do not. I never prescribe it or recommend it, honestly,
Right.
because I'm a bit biased. So even for
Sure.
women with different malignancies,
Because that's all
I don't
you see,
recommend it.
and that does bias
To me,
us.
it's the rule. Yeah.
What the GYNs will say is that you can take the pills for the relief of severe hot flashes, but you want to take it only as long as you need it, and then they got to get off of it just as soon as you can. But again, the topical estrogen, which is estrogen cream, is used pretty commonly for dryness, itching, burning, or discomfort with intercourse. Now, we used to prescribe it not for all of those things, but to prevent bone thinning. And because women who lose estrogen start to lose bone mass pretty quickly, and you can be at increased risk of bone fracture. But we don't use estrogen for that anymore. We use drugs called bisphosphonates for that. So.
And that is always interesting to speak with women who have breast cancer, because if they've had, if they're postmenopausal and have the estrogen positive breast cancer, maybe they're not secreting estrogen from their ovaries, but you still change testosterone into estrogen through a molecule in your fat cells called aromasin. And so we block that routinely with
Right.
pills. And so from there, we have to put them on bisphosphonates just because their bone mineral density goes straight down.
And those aromatase inhibitors are can cause. If you know anybody that's on that and they are complaining about all of a sudden now they have arthritis, they can cause joint pain. We call it aromatase inhibitor associated or induced arthralgias. And in those people, that's the number one reason that they stop those things. And it's therefore one of the highest reasons for, putting women at risk for recurrence of their breast cancer because they're not taking their Aromasin. So that's an issue. So if you know anybody like that, that can be treated. There's a protocol for treating it.
So I was just reading, there is a new pill that I keep seeing on Instagram called the Little Pink Pill to increase women's sexual desire.
Okay. Oh,
So-
well, if that's what he's worried about,
Yeah.
which it sounds like it from the thing is he wants to increase his wife's libido. Go
it's
ahead.
called Addyi, Addyi, flibanserin.
Yeah, flibanserin.
Flibanserin.
That flibanserin.
Listen,
He's out of his flibanserin.
Sarah's crazy.
you can't take somebody out of the swamp. So it's
Okay, Dr. Scott pronounced islet cells islet cells on this show once.
That's how they pronounce it.
And then we called
Yeah.
we called it on him. He said that's how they pronounce it in China. So.
So it's a serotonin 1A receptor agonist and serotonin 2A receptor antagonist for premenopausal women.
Yep.
You
got to be premenopausal though.
The MOK.
It's premenopausal women with hypoactive sexual desire disorder. Now you know it was some man came up with that name for this.
Probably like a fat man.
Yeah, big fatso. And
I'm
he's like,
joking. I shouldn't have said.
I know.
I'm not body shaming. I'm just saying.
Well, men, you can body shame the shit out of them. It seems to be totally fine. So
We don't really give a shit.
no, I do, but it's
Hey, I'm old and fat and gray-headed. I'm okay with it.
whatever. Anyway, but yeah, hypoactive sexual desire disorder. So if that's what the issue is, have her talk to her OBGYN.
Yeah.
There are some people that advocate the use of testosterone in those cases. There are downsides to that as well. All right, very good. Let's do. Oh, good. We've got some really good questions in here. I had a guy. Oh, wait. We wanted to play D from Nashville's thing. Hang on. Let me find that. Yeah, the nastiest smell. See
Oh
if we've
wait,
got
I
time.
have. It's
Yeah.
a lady who quit her job after she smelled it
Yeah. Oh, yeah.
and went to work as
shit.
a nail tech
Okay.
or something. Oh, did I just ruin it all?
No, it's okay. No.
I'm
If
sorry.
you've heard it before, that means we played it recently. So
Yeah.
okay. All right, Taste. We're almost done. Jesus Christ.
It's 4,000 degrees in here.
No,
At least
it may be-
I had
maybe
I
more-
do have a
maybe more
crazy
than one.
story. Are we about to do some questions?
Yeah. Well, we've got about a minute. That's the
Okay, let's
problem.
do it.
So
Is your
let me-
story under a minute?
It's.
Can you do it under a minute?
Yeah, heck yeah.
You can. Okay.
So I was
hang on.
asking
Hang on.
one of.
Hang on. Hang on.
Okay.
I'm gonna go back and
Oh yeah, let's go back.
I'm. Wait, hang on. I gotta find a good place to
We can do a
put this
question
in.
too. It's
No,
just
no,
a
no, no. It's
No,
okay.
funny
No, we
story.
can't.
No,
It's
no.
too hot.
Okay.
Lydia, tell your story real quick.
Okay, so I was doing a little market research, right, for the show. Asked one of my friends for any gross stories, and friend happens to be a swinger. And so he said,
As in to swing?
to swing,
Okay.
like swinging parties.
Oh,
and-
Right, right, right.
Yeah, consensual swinging.
You have 30
So,
seconds.
anyway, asked about it. He said, well, I've always avoided like chlamydia. However, at one event, about 6 of us got pink eye.
Oh,
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 Isn't that fun?
oh, that's awful. And the pink eye could have just been a viral
I
pink
think
eye. It could have been
someone's kid had it.
chlamydia, though. You can get chlamydia conjunctivitis.
Yeah, I think it was somebody's kid that had it.
I just
but
oh, they had
anyway.
a kid there. No, I
know,
get it.
in
I
the same
get it. I get it. Jesus. All right. Well, thank you, and thank you, Dr. Scott and Tacey and PA Lydia for dealing with the heat up here. I swear one of these days I'm going to get it fixed. And thanks for everybody for hanging in there. Until next time, check your stupid nuts for lumps, quit smoking, get off your asses, get some exercise. We'll see you in 1 week for the next edition of Weird Medicine. Thanks, everybody.
Thanks.
Thank you.
Thank y'all.
All right, let's do. So I'm just going to read the ending of the other thing where we're not doing any more fucking questions. I don't
It
want.
was orgasm.
Oh, that's
I was
hilarious.
like, I get that.
Poor Lydia. God bless her. It's an orgasm at following an following an orgasm.
Now there are sex headaches. You know, that's a real thing. Now, if you're going to do that, you can't do it on the mic, though.
Not.
Okay. I know. Well, I could hear it. Okay. Sorry. All right. Thanks. Always go to Dr. Scott. Thanks to everyone who's made this show happen over the years. Continues to be the most fun I've had in several decades of existence on this earth. Listen to our Sirius XM show on the Faction Talk channel, Sirius XM channel 103, Saturdays at 7 p.m. Eastern, except now we're being, God damn it, I fucked up big time. Hang on just a second. Oh, no. Yeah, just calm down.
At least you didn't call it Flibbin' Sarin.
Flippin' Sarin. Flippin' Sarin's crazy.
Hang on. Okay, we're all right. We're all right. Okay, let's try that again. Thanks. Always go to Dr. Scott. Thanks, Tacey. Thanks, PA Lydia. And thanks for hanging in here in this hellhole of a studio. Thanks to everyone who's made this show happen over the years and continues to be the most fun I've had in many years of existence. Listen to our Sirius XM show on the Faction Talk channel, Sirius XM channel 103, Saturdays at 7 p.m. We are being preempted right now for until the whatever sport season is over that's going on right now. Sundays at 6 p.m. Eastern on demand, and other times at Jim McClure's pleasure. And we may be on at Sunday at 10 right now. So good luck finding us. Many thanks to our listeners whose voicemail and topic ideas make this job very easy. Go to our website at drsteve.com for schedules, podcasts, and other crap. Until next time, check your stupid nuts for lumps. Quit smoking, get off your asses, get some exercise. We'll see you in 1 week for the next edition of Weird Medicine. Thanks, everybody.
Goodbye.
Bye-bye.
Bye, guys.
Okay, now let's do the intro. And then we'll be done. You guys can...
I really dig earthworms. But I haven't met one yet that doesn't have a dirty mouth. How is a private eye? Like the dry cleaners? They both do other people's dirty work. Why was the egg sent to the principal's office? It cracked too many yolks.
If you just read the bio for Dr. Steve, host of Weird Medicine on Sirius XM 103 and made popular by two really comedy shows, Opie and Anthony and Ron and Fez, you would have thought that this guy was a bit of a clown.
Why can't you give me the respect that I'm entitled to?
I've got diphtheria crushing my esophagus. I've got Ebola virus dripping from my nose. I've got the leprosy of the heart valve, exacerbating my incredible woes. I want to take my brain out and blast it with the wave, an ultrasonic echographic and a pulsating shave. I want a magic pill for all my ailments, the health equivalent of Citizen Kane. And if I don't get it now in the tablet, I think I'm doomed and I'll have to go insane. I want a requiem for my disease, so I'm paging Dr. Steve. Dr. Steve!
From the world-famous Cardiff Electric Network Studios. It's Weird Medicine, the first and still only uncensored medical show in the history of broadcast radio, now a podcast. I would redo that, but Tacey would kill me. It's 1,000 degrees in here. I'm Dr. Steve with my little pal, Dr. Scott. Traditional Chinese medical provider, gives me street cred with wacko alternative medicine assholes. Hello, Dr. Scott.
I'm on fire.
And we got Tacey. Hello, my partner, Tacey. Hello, Tacey.
Shoo, it's hot in here.
And we've got PA Lydia back from sabbatical. Hello, PA Lydia.
Hello. you.
This is a show for people. Thank you. This is a show for people who never listen to a medical show on the radio or the internet. If you got a question you're embarrassed to take to a regular medical provider, can't find an answer anywhere else, give us a call at 347-766-4323. That's 347-POOHEAD. Follow us on Twitter at Weird Medicine or at drscottwm. Visit our website at drsteve.com for podcasts, medical news, and stuff you can buy. Most importantly, we're not your medical providers. Take everything you hear with a grain of salt. Don't act on anything you hear on this show without talking over with your healthcare provider. Very good. Please don't forget stuff.drsteve.com. It really makes a difference. Stuff.drsteve.com.
It could actually maybe pay for an air conditioner in here.
Shit, I researched that. They want
fan.
$5,000 to put a silent air conditioner in here. Well, when you go away for the weekend, instead of going out and doing something fun, I will install a fucking ceiling fan in here, but I got to find a silent one like they got at Liam's apartment. That thing is awesome.
It is silent.
And it is silent.
And
so
we
I
would
will
live
take
in
care
heaven,
of that.
Scott.
I'll take care of that.
Together we'll be in heaven.
So I will do that. So when are you going out of town?
December.
Help. Just go this weekend. That'll be my birthday present. You out of town.
You'll be out of...
Okay. Just kidding. I'm just kidding, honey. You can stay. Go to stuff.drsteve.com. Scroll down and go through. Okay. And go to Dr. Scott's website at simplyherbals.net. There you go. Check out our Patreon or don't. It's patreon.com/weirdmedicine.
It'll be hot that day, too.
Yep. And, we got to do one this weekend, by the way. So let's just get up here early and it's not hot.
Okay,
and I'll
fun.
work on it. Okay. Yeah, this is so much fun. All right, you guys are done. Thank you. I guess we're not playing a song.
We'll play it, but you can turn it up to the don't know, can't you?
Okay, I can turn it on, yeah.
Hell yeah, goddamn. Put on 67.
Yeah.
Oh. Let me dry my ass out.
You were fine. You didn't do anything wrong. It wasn't anything you could control. It reset itself when the power went off, and I didn't know that it did that. So that's not your fault. Jesus fucking Christ.
Yeah.
I know.
That's what was Lydia was blocking the damn fan. That was the problem. Damn Lydia.
Yeah, a fan blocker.
She's so thin.
Are you two going to hang out, Dan? So you're going to hang out for a while? Okay, we won't be too long.
We can butcher some songs pretty quick. Oh my God.
We're keeping you up, dude. All right. What's today's date?
Today is the 8th. Yeah, 9/8. I'll email it to you right now.
Okay, thanks. All right. Maybe a little stuttering in the feed as I upload that to our server. One of the things, I've got a fucking rectal abscess. I wanted to talk about it, but I guess we'll talk about that on Patreon.
Oh, you do?
Oh, yeah.
Oh, those are wonderful.
Oh, yeah.
It's a little challenging to get comfortable, isn't it?
It's impossible.
All right, you got I just sent you today's topic.
I got
Who'd you go see?
Fucking assholes giving me shit.
Yeah. Literally and figuratively.
Oh, it's hot. It's hot. You can be uncomfortable for an hour of your life.
Feel like Merle Haggard?
I'll play anything you want to play.
I thought about Merle Haggard, Mama Tried. Then I thought about Summertime, the old Summertime from Willie Nelson.
Do whatever you want.
Willie Nelson version.
We can do Summertime. You want? Well, yeah, I'll do whatever you want to do.
First thing I remember knowing, alone
Now, are you plugged in or are you going to do acoustic?
I'm plugged in.
Okay, let me get you in here. There you are.
Let me find a key here, Dr. Steve.
Okay.
The key. First thing I remember knowing was a lonesome whistle blowing and a young's dream of growing up to ride on a freight train leaving town, not knowing where I'm bound. No one could change my mind, but Mama tried. So DG. And then the A is it just so first thing I remember knowing G is a lonesome whistle blowing and a youngin's dream of growing up to ride on a freight train leaving town, not knowing where I'm bound, and no one could change my mind but Mama tried. I think it'll work, don't you? Yeah. And the chorus is a D, G, and it goes to the B minor. So the chorus is and I turned 21 in prison, doing life G without parole D, and then B minor. No one could steer me right, but Mama tried. So it's B minor to A. B minor.
Play it.
Yeah. So I turned 21 in prison, doing life without parole. No one could tear me right, but Mama tried. Mama tried to raise me better, but her pleading I denied. That leaves only me to blame, but Mama. Let's do the chorus again. Turned 21 in prison, doing life without parole. No one could tear me right, but Mama tried to raise me better, but her pleading I denied. Now leaves only me to blame. Mama tried.
Not go to the B minor twice, just the once?
Just the once, yeah. No, according to this.
Okay.
Do it again. Do the chorus one more time. Yeah, let's do the chorus. So I turned 21 in prison, life without parole. No one could steer me right, but Mama tried. Mama tried to raise me better, but her bleeding I denied. That leaves only me to blame. Mama tried. Dear old Daddy, rest his soul, left my mom a heavy load. She tried so very hard to fill his shoes, working hours without rest, wanting me to have the best. She tried to raise me right, but I refused. So I turned 21 in prison, doing life without parole. No one could tear me right, but Mama tried. Mama tried to raise me better, but her bleeding I denied. That leaves only me to blame, 'cause Mama tried. Okay. This sounds too metally, doesn't it?
No, you can change the tone.
Yeah. That might be a little better. He just didn't like it. All right, you'll do it. Let's do it. And then we're going to switch over to, we'll do Summertime.
All right.
Yeah, that's cool enough. Thank you for turning that on. Jeez Louise.
Yeah.
I hate to be a big crybaby. Kick it off there, big boy. First thing I remember knowing was a lonesome whistle blowing and a youngin's dreams of growing up to ride on a freight train leaving town, not knowing where I'm bound. No one could change my mind, but Mama tried. One and only rebel child from a family meek and mild. My mama seemed to know what laid in store. Despite all my Sunday learnings, towards the bad I kept on turning, till Mama couldn't hold me anymore. So I turned 21 in prison, doing life without parole. No one could cheer me right, but Mama tried. Mama tried. Mama tried to raise me better, but her bleedings I denied. Now there's only me to blame, but Mama tried. Dear old daddy, rest his soul, left my mom a heavy load. So he tried so very hard to fill his shoes, working hours without rest, wanting me to have the best. She tried to raise me right, but I refused. So I turned 21 in prison, doing life without parole. No one could steer me right, but Mama tried. Mama tried. Mama tried to raise me better, but her bleedings I denied. Now there's only me to blame, but Mama tried. That leaves only me to blame, 'cause Mama tried. There you go. That's a good old song.
When you did the instrumental break, though, you varied from the formula, and I got
Just
lost.
trying to keep you on your toes. Brother.
Yeah, you did.
Hey, like I've always said, I've got Willie Nelson timing.
No, well,
It's all over the place. Let's do Summertime.
okay.
E minor.
In E minor, we used to do it in A minor.
Now we do
Oh no, I remember Summertime. You want to do Willie's version?
Yep. Let's see if anybody's still in the chat room. There's Cece. What's up, Cece? Mama did try, didn't she, Cece?
Didn't try that hard.
Didn't try that damn hard. Could have tried hard.
No, we always.
You want to do an A minor? We can do A
We
minor.
started
I don't care.
on A. Well, no, it's not that. That's how we used to play it.
It's just been so long since we played it.
I know.
I just heard it. I just heard Willie do it the other day.
All right.
Yeah, we'll do
Oh,
A
we
minor.
haven't played this in so long.
Summertime. And the living is easy. Fish are jumping, and the cotton is high. Your daddy's rich, and your mommy good looking. So baby. Honey, don't you cry. One of these mornings, you're gonna rise up singing. You'll spread your wings, take to the sky. Until that morning, there's nothing gonna harm you. When your mommy and daddy standing by. Summertime and the living is easy. Them old fish are jumping and a cotton his eye. Your daddy's rich and your mommy's good looking. So hush, little baby, don't you cry. Back to sea. So hush, little baby, don't you cry.
Nope, we're not doing that.
Dang it! I thought I had you lulled to sleep. I had you lulled to sleep.
All right. That was not good. But
That was
it wasn't
awful.
that bad.
Sorry, guys, it was terrible. That was my fault.
No. Considering we hadn't played that and since, God, right after G-Back died.
Yeah, it was a long time.
So that was a long time ago. But we could learn that one again.
Yeah,
I could do more of a swing bass to it too.
I like it. I think that's what I think it's been so long since we played it.
No, that was how I used to play it, but I could do a
swinging
swing
basses. Yeah, I think that's the way to do it. The swinging's the way to do it. All right, boys and girls, we're out of here.
All right, thanks everybody. It was
We
a little rough
will-
today, but it was fun though. We got some good shit in. PA Lydia is always fun.
Yeah, Lydia's good. We'll see you guys in a week. Thank you for tolerating our insanity. He didn't realize Sublime's version was a cover.
Sublimes did a cover of Summertime?
I think so.
Oh, God, it goes way back, dude.
Yeah.
Yeah, let me see who wrote it and when it was written. When was Summertime written? 1934.
Wow.
George Gershwin.
Is that who wrote it? Good.
Yep.
Wow, that makes sense.
Fucking Gershwin is awesome.
Isn't that cool? That song's sustained for years. Hey, thanks for the chords. Those are cool.
Yeah, you're welcome. I figured you already had that.
No, I don't have that. No, I don't have it at all.
All right.
Yeah, it was a good show. It was just